Assalamu alaikum. We have a couple of problems that I need you to help me with. Any suggestions are welcome. First, I have a cup, which is my partner for the speech or the talk or the discussion, and the mic that I need to speak to in order to make you hear my my voice. Yeah, this is one problem. The other problem is that I need to speak to you and I need to read from paper. And I have two problems with sight: farsightedness and nearsightedness. So I don't know how can I switch the glass on and off or up and down, and at the same time keeping the mic and the cup. So I am not really in a very good shape, but I'll try my best. And to begin with, I would like to thank the organizers for this wonderful conference. Is going, I think, fine, so well. It's colored in pink, which is really nice. And one of the things that I was all the time talking about is that we are not going to see any young ladies after 6 p.m., But I think more than half of the audience are ladies tonight. So thank you very much for being here. I am sure that you came because you knew that I'm going to talk about things, So good. A minute and a half, maximum 15 is my time. Good. So let's begin with my colleague. In mental health, when you all the time try to make people motivated, because I am supposed to be the motivational guest speaker, yeah? So you all the time tell people, do not look at the empty side of the cup, yes? Yes. So you should not look at this empty side, you should look at this side, and if you look like this, then it's better. You will not see at all anything empty. But you are students of medicine, isn't it? So if you are learned, you receive teachings that whenever someone comes with a symptom, you need to look everywhere until you find the empty side of the cup. Why? Because you need to reach the diagnosis. Without reaching the diagnosis, you will not have a good treatment plan. Yes? So how can I today come, and I am a medical doctor, tell you, please do not look at the empty side of the cup? Would that be really right? Would you really take it into consideration? You will say, no, he is, we all the time heard that, do not look at the empty side of the cup, but the reality is really a different one. Things are difficult, things are not easy. So we need all the time to be aware of things. And in order to become a medical student, I am taking you back 5 years ago, 4 years ago, 6 years ago, maybe more than that, and you had to do well in math. Math is 200 grades. You cannot become a medical doctor if you get less than 90% in math. You are out of any chance that you get accepted to one of the both medical schools in Gaza. So how can someone who is excellent in math understand that do not look at the empty cup? Well, I'm not going to tell you today to look at the empty side of the cup, but I would like to tell you that you need all the time to be confident in your assessment. We say good assessment yields good diagnosis and ends with good management. So the patient will be at the end of the day happy and saved. God's will, of course, inshallah, yeah, with your help. You will be the tool to help the patient. So if you are a tool to help the patient, well, for the sake of everyone, be a good tool to help yourself, first of all, isn't it? Yeah. So when you look at things, and you know that life is not that easy, and you know that you are a medical student, and you know that you have many exams, and you have many lectures, and those lectures are different. Some of them are excellent, some of them are not so excellent. Yeah. So keep in mind that, okay, we are halfway through. We are still having the other half, isn't it? So we are halfway done. We are even more than halfway done. For a medical students today, most of them are 5th and 6th grade. You are almost done, You better now think about what's next. What's after medical school? Where am I going to do the residency program, the internship? Where am I going to do the subspecialty or the specialization? Which specialty I'm into? Which country I need to go there? Is it in Palestine? Is it in Gaza? Should I join the Ministry of Health, look for a residency program, or look else? Where? So this is part one of my talk. It's 5 minutes. If we are lucky, I'll finish in 15 minutes. Okay. And inshallah, we will be all lucky. Mental health awareness, motivational, and to speak about mental health awareness. Mental health is really a big issue. And I think I can say to the CUP a little bit, wait for me here, please. Thank you very much. A big hand to the CUP that really helped us deliver the first message. So the question is mental health. What does it mean to be aware of mental health? I'll give you 3 or 4 figures, and these are extremely interesting and extremely, annoying at the same time. Every now and then I look into prevalence of mental illnesses, sometimes prevalence of specific disorders, sometimes prevalence of mental health illnesses at large. Why? Because part of your work, tomorrow you will go through this, you are already doing it, is to talk about the field that you practice, to promote it to the population or to policymakers, to speak about the importance of the field that you are working in. So some of the 2017 research studies, they were talking about 1 in 10 persons, that's about 10% of the population in any given place will have some mental health issues, will have mental health illnesses. Imagine 1 in 10. And then when you look and do it, please, Google it, you will find that in the year 2020 to 21, they are saying that 1 in 5, 20% of the population, 1 in 5, okay? Which means 20% of the population. And they say that the reason behind that is what happened between the 2017 and 2020. The biggest thing is COVID, the monster, which came with social distancing and terrible economy. The socioeconomic conditions globally were really low. We're going lower and lower. And they blame it on COVID. That's why it moved from 1 in 10 to 1 in 5. Even, I think, I read a 2022 article about the United States. They say about 26% of the population has a mental health issue. 1 in 4, it means. Well, anyway, 1 in 10, 1 in 4, 1 in 5, name it whatever you wish. There is a serious issue about the mental health among population, and this is not for a specific place to begin with. This is a global issue. Another thing, issue. So if it's 1 in 10, then you need, it's a quite significant issue. You know how many people with diabetes are in Gaza, Gaza Strip? Anyone knows? How many people with chronic illnesses, diabetes, hypertension? It's about 120,000 people. Those are registered for chronic illnesses, which is less than 10%, actually maybe 7% of the population. So assumingly, if we follow the 1 in 10, not the 1 in 5, then we have really more serious problem with the mental health issues, with the mental health concerns. And this is concerns, and this is something that is global. So you expect the resources of people who work in health to be allocated towards or to be shifting towards mental health, because those are the needs. The WHO says that less than 2% of the health budget goes to mental health globally. Do you know what does that mean? That means that at the level of even policymakers, we do not have enough money that goes into mental health. They spend it on different things. What? Of course, surgeries, for example, primary health care, of course, they talk about primary health care because primary health care make it more cheap to provide the services. It's all the time better to intervene early, to identify people at risk, to work with them, to promote healthy habits. It's a lot better than what? Than to treat people. It's a lot cheaper than treating people. So that also applies to mental health, okay? That also applies to mental health. However, it's not only with money the problem. There are some other problems, For example, they say globally 1 in 100,000 people work in mental health. So it's the lowest number of workers, the ones who work in this field. And then we have a big issue, which is stigma. Stigma is a big issue. Well, I might understand that people are afraid of talking about mental health, you know. They are not that much really, how to say, happy or open to discuss challenges that are related to mental health, or to talk about a relative who is complaining or having a mental health issue. But we, the medical practitioners, also have our own way of stigma. For example, at least we have here 100 students. The ones who would like to become psychiatrists, please raise your hand. Be honest. Be honest. Assuming that you are honest, and I believe so, we have only one. Thank you very much. This is a very nice proof. So this is one issue. Another issue, if I tell you, look, I went to the psychiatrist today and he gave me a medication. He told me it will help me sleep. What are you going to tell him? Oh no, medication, psychiatrist, sleep. No, 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 no. Don't do it. Don't take it. It will cause addiction. It will cause tolerance. It's a substance abuse. It will make you crazy. You will become dependent on it. Blah, 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 blah. That's it. Yeah, you advise all the time people to try not to go into the medication. And this is, again, it's against all the literature. You know, we need to be evidence-based. It doesn't apply only to myocardial infarction. It doesn't apply only to carditis. It doesn't apply only to renal failure, but it also applies to psychiatry, you know. So illnesses in mental health and psychiatry are like other illnesses. They have evidence-based practices, adhere to the evidence-based practices. I still have 3 minutes. So what can we do to help develop this sector, increase awareness? Awareness, which means first, improve the people's awareness of mental health issues. I can give you one example. Why children sometimes they become aggressive. Why children sometimes start to have problems with concentration. Look around, maybe there is a problem in the family. Maybe something wrong happened around them. Anything that could be happening around them can make them a little bit afraid. That might cause them to become, rather than afraid and telling you I'm afraid, they can become irritable, or they can become angry, or they become disobedient. Tell the people that this is a sign that needs some intervention, needs maybe a good hug from the father or the mother. Maybe it needs someone to tell them a story before they go to sleep. So educating the population is one. Second, to work with the policymakers is very important. Because policymakers, they all the time need to be pushed towards responding to the population needs, and they don't do it usually because it means mobilizing resources, and that needs really an important issue, which is to push them doing that. And the third thing is work among yourselves to get more information and more knowledge in order to advise people, whether you are in the primary healthcare, on the hospitals, or at home, or at your neighborhood. You need to be able to give them the right advice. I still have 1 minute, and I'll just devote it to the motivational part. Today, I was really glad, first, to hear these young people, Dan Al-Kahlout, Yusuf Sab'a. I don't know what happened in the morning. I am sure there were more wonderful people. And I also was happy to hear Omar and Najjar. These are excellent examples of students that they have already done and contributed something. And I believe that all of you can do the same once you have the will to do that. A little bit earlier, I was at the graduation ceremony of the medical faculty of the Islamic University students. It was a very nice and lovely event. It continued for 2 hours full of joy and happiness. You are the 5th, maybe the 4th, 6th year students. In 1 year, inshallah, or 2 years, we are going all to celebrate you becoming a medical doctors, and here you do the oath of becoming a medical doctors. Good luck with your life and good luck with your career, and thank you very much.